Medical decision making. At any time, please feel free to pause or replay this video. The levels of E&M services recognize 4 types of medical decision making, which are straightforward, low complexity, moderate complexity, and high complexity. Medical decision making refers to the complexity of establishing a diagnosis and/or selecting a management option as measured by the number of possible diagnoses and/or the number of management options that must be considered. The amount and/or complexity of medical records, diagnostic tests, and/or other information that must be obtained, reviewed, and analyzed. The risk of significant complications, morbidity, and/or mortality, as well as comorbidities associated with the patient's presenting problem, the diagnostic procedure, and/or the possible management options. The Centers for Medicare and Medicaid Services evaluates MDM based upon the highest 2 of the above 3 elements. For a presenting problem with an established diagnosis, the record should reflect whether the problem is improved, well controlled, resolving or resolved, inadequately controlled, worsening, or failing to change as expected. The need and reason for referrals, consultations, and advice sought should be recorded in the chart. Use the TAMPER acronym to remind yourself of which diagnoses should be documented. Treat, assess, monitor and/or medicate, plan, evaluate, and refer. The amount and complexity of data to be reviewed is based on the types of diagnostic testing ordered or reviewed. The medical record should clearly reflect if any of the following have been performed. The risk of significant complications, morbidity, and/or mortality is based on the risks associated with the presenting problem, the diagnostic procedure, and the possible management options. Comorbidities and underlying diseases or other factors that increase the complexity of medical decision-making by increasing the risk of complications, morbidity, and/or mortality should be documented. If a surgical or invasive diagnostic procedure is ordered, planned, or performed at the time of the E&M encounter, the type of procedure should be documented. If it's not documented, it won't be coded. Medical decision-making is the thought process of the physician throughout the visit. Consider starting the MDM section with a summary of the patient encounter and a list of the differential diagnosis. The body of your MDM should describe how you work through your differential. Describe and interpret the data that you obtained and reviewed. Be sure to use a phrase such as "on my interpretation" when independently interpreting radiographs or ECGs, and briefly summarize prior visits that you reviewed. Always document the route of administration and the name of the medication that is being administered. Certain parenteral controlled drugs carry a higher risk. Document if it is the patient's or family's decision to not opt for an aggressive treatment plan for conditions that carry a poor diagnosis. For a presenting problem without an established diagnosis, the assessment or clinical impression may be stated in the form of a differential diagnosis or as possible, probable, or rule-out diagnoses. The medical record is a legal document that is required by law and regulatory bodies. An incomplete or deficient medical record demonstrates that care was incomplete, contributes to inaccurate quality and care information, and causes lost revenue and reimbursement. This training video is brought to you by Practicefirst.